Hi guys, in this video I'm going to talk all about why you might be having some hip flexor tightness. So a lot of people that come to me with tension in their hip flexors really focus on stretching their hip flexors. Now that may not be a bad idea if the hip flexors are the cause of the issue, but in my mind there has to be something causing the hip flexor tightness. Now one of the most common reasons I see people having tension in their hip flexors is actually overutilizing or having a lot of shortness or tightness in their deep glute muscles. So you have different types of glutes. You have the superficial glutes, which are the bigger glutes that run in the back of your pelvis, and then you have your deep glutes, which are located very deep in your pelvis, almost near your pelvic floor muscles. Now the deep glutes sit right behind the hip joint or the hip socket. So if those muscles are very tight, so let's imagine this is our femoral head, this is our hip bone, and it's sitting in a socket. Now, the front of the pelvis is right here, which is where our hip flexors are, and our deep glutes are wrapping around the back deep portion of the pelvis. So if these deep hip rotators, your deep glutes, are really tight and short, they are going to shove the femoral head or the hip bone forward into the hip flexors. Now the hip flexors are going to be like, I don't like that. So they're going to tense up and shove the femoral head back. So there's like a tug of war going on with your deep glutes and your hip flexors. So if you're just focusing on stretching your hip flexors, you're not really solving the root cause of the issue. Now, a lot of times, a lot of people with hip flexor tightness tend to have a lot of posterior pelvic tilting. They may not be able to sit very tall without feeling tension in their hip flexors. As an example, a lot of my patients, when I tell them to sit up nice and tall, they feel these hip flexors like over tightening up. If they kind of slouch, it feels better. But what's happening is as I'm trying to sit up tall, it's hard to do that because in order to sit tall, my deep glutes have to lengthen so that I can sit tall. But that doesn't happen. So my hip flexors are tightening up and shoving the hip backwards. So again, one of the main causes of not being able to sit very tall is not really necessarily tight hamstrings. It can also be tightness in your glutes because again, your glutes need to lengthen in order to sit tall. And if you can't do that, you're just going to feel a lot of tension in your hip flexors. So lengthening your glutes will help the hip sit better into the socket, and it will make your hip flexors a lot more happy and less angry and sad.